Welcome everyone, good afternoon, and thank you very much for joining us. My name is Agata Miśkowiec and I'm a principal consultant with Mutual Ventures. We are a consultancy that works with public services with a special focus on children's services. If you are here to learn about effective use of data in care proceedings, then you are in the good place. I am joined today with a number of guest speakers from Worcestershire and Warsaw. So thank you very much for joining us today. You will hear from them later today. They will be sharing with you examples of good practices and how they track cases in their local areas. As you may know, this is the second event in our series of learning events. These webinars follow on from a project that many of you here today had been a part of, investigating the financial impact of delays in care proceedings. Today's session is focused on data, but we kicked off the series last week with an excellent session on pre-proceedings with a guest speaker, Sarah Henry from Warrington Council. And we're also discussing the importance of data, in particular a national pre-proceeding data set currently in development. So if data is your thing and you haven't seen the webinar, I highly encourage you to watch a recording that is now available. And we'll also have two more sessions this month, next week looking at workforce, and in 2 weeks on culture. And just to let you know, we will be sharing the slides along with the recording after this webinar. So hopefully you will be able to access the registration links if you haven't registered already. In terms of the agenda for today, we have quite a packed agenda this afternoon. I will start running you through the key insights from our financial modelling work that many of you contributed to. I will then hand over to colleagues from Worcestershire and Warsaw, who will present how they track cases in their areas, how this data feeds into practice at the local and regional level, and most importantly, how data is used to support better outcomes for children. And finally, there will be time for questions. You should all see the Q&A function on your Zoom screens. So please feel free to submit your questions as we go, and we will come back to these at the end of the session. Before we dive in, just a quick project overview, a reminder of why we're here today and where this information that I'm about to tell you comes from. The project has been commissioned by the Department for Education. The objectives were twofold, really. Firstly, it was to develop and roll out a financial modelling tool, allowing local authorities to estimate the financial impact of delays in care proceedings. But of course, while it's helpful to know how much delays are costing you, the more important question is, so what question, and how to tackle delays. So as part of the project, we've been also engaging across the family justice system, developing a national level evidence base and some practical responses to delays. And we were really privileged to engage with a broad cross-section of stakeholders from across the system, local authorities, but also we talked to judges, CAFCAs. We had sessions with young people and families that had previous experience of proceedings. So all these stakeholders informed our findings. There were a number of project activities. Today we will be focusing specifically on financial modelling exercise. But just to let you know, there were more activities, also more on qualitative side, which are informing some of the other learning sessions that we are running. And my presentation today will be really just a whistle-stop tour, as I want to make sure that we have enough time for our fantastic guest speakers. But if you would like to access more information on the project or download the financial modeling tool, if you still haven't used it, please visit our website. This is also where we will be publishing the report with a recommendation from our work. So this was the introduction. Now let's move on to the main part. Firstly, let me introduce you quickly to the financial modeling tool that we've built. Many of you have already seen it, so I won't spend too much time on this. This is a relatively simple tool based in Excel that focuses on impact of reductions in 3 key drivers of proceeding costs: duration, number of hearings, and number of non-local authority assessments. To use the tool, local authorities need to follow a 4-step process. Firstly, they need to input some baseline proceeding level data, including duration, number of children, hearings, and assessments. Then there's a set of cost impact assumptions. We're also looking at placement costs. And finally, there's a what-if analysis, where local authorities can define and compare various scenarios. And when a local authority goes through all these 4 steps, this is what the output of the what-if analysis looks like. And the graphs show the comparison between the original baseline and the new remodeled scenarios. And I know there's a lot of here, but the most important part is the pie charts at the bottom, showing the breakdown of estimated avoidable costs, including a breakdown of placement costs, staff costs, and non-staff costs. And the number here are based on an example local authority. But I will give you later on some insight based on the data that we've received from a number of local authorities nationally. So we know broadly how the tool looks like, but how it can be really used. So the primary use of the tool is for local authorities to give them insight into data that hasn't been available before. And we've heard from local authorities that participated in the project that they are using or planning to use the information from the tool, for example, to inform business cases, investor-safe proposals, or budget setting conversations. But on top of that, a number of local authorities also submitted their data to mutual ventures, which allowed us to extrapolate the financial impact of delays at the national level. So now I'll take you very quickly through the key data insights based on the data we've collected. So as you may remember, the first step was around the proceeding level data. And what is worth noting here is a large variance in the average number of assessment per case reported by local authorities, ranging from 0.5 to nearly 7, and similarly for hearings, with the average around 6, but some local authorities are reporting over 9 hearings per average per case. And this is significantly higher than the current PLO guidance of 2-3 hearings per case. The highest number of hearings per individual case that any local authority reported was 24, representing a huge cost to the local authority, but admittedly also very poor experience for everyone involved. Moving on, the second step of the process focuses on cost impacts, mainly staff costs and other third-party costs. And one thing that I would like to highlight here is a very high cost impact of hearings. This is linked and driven mainly by a high use of external barristers by many local authorities, not only for more complex cases, but sometimes even for all cases due to legal teams' capacity pressures, as you can see on the chart on the right hand side. And lastly, we looked at placement costs. So this will come as no surprise to anyone here. Placement costs put a lot of pressure on children's services budgets, especially those expensive out-of-area residential placements. However, what we also found is that the placement cost per week is generally higher during proceedings than following the completion of proceedings, on average by nearly £400 per week. But as you can see, the average difference in placement costs during and after proceeding can be as high as £1,300. There are a combination of factors that contribute to this. For example, children returning for foster and other placements to various arrangements with family, children being placed for adoption, or use of costly residential parent and baby assessments, sometimes for a relatively long time during proceedings. But generally, care proceedings delay are automatically inflating already high placements budgets. So what is the overall cost impact of delays? Overall, if we were looking at potential savings or cost efficiency, if one care proceeding was reduced by just 1 week, this is around £700, including all staff, non-staff, and placement costs. It may not seem like a lot, and of course this is an average value, and it will differ depending on a local authority, region, or a specific case. These numbers add up quite quickly. So nationally, if all proceedings across English local authorities were shorter by just 1 week, which would represent a shift from the current average of 46 weeks to 45 weeks, the approximate cost impact would be around 18.5 million, plus minus, of course. Of course, these cost impacts may not all represent cashable savings. Placement or barrister costs that we have discussed will generally be cash expenditure, but any staffing costs for many local authorities will, in practice, represent reductions in workload. But this is also important because, as we all know, many local authorities operate on a burning platform and has significant challenges with both recruitment, retainment, and high caseloads. The last thing I would like to cover today before I hand over to our speakers are some challenges around how local authorities are using data. So this financial modeling exercise made clear that there are some challenging areas and improvements needed regarding how local authorities and other partners across the system collect and use the data. Some local authorities struggle with significant gaps in operational data, for instance, where it's not routinely shared with Kafkas and courts. Many local authorities struggle with data silos, where data is held by various departments and not shared routinely between teams. So, for example, we've worked with local authorities where legal teams were actually not aware what their total spend on barristers is, because this data is collected by finance team and not shared back with the legal team. And finally, sometimes there's also an issue around trying to do too much without the right tools at hand, such as smart data capture tools, business intelligence tools, or effective use of case management system. This may involve case progression managers manually maintaining huge spreadsheets with all sorts of data, where updating data sets becomes a whole industry, to the extent that there's little to no space left to actually take a step back and reflect on whether that data gives actionable insights and how it can be used to inform decision making. So I think it's fair to say that there is a high variance within local areas around the ability of teams to collate and use data. And this is not only about technical skills and tools, but perhaps even more importantly, about data use culture and how it's used for decision making. And I know that for many local authorities, this is an ongoing improvement journey. And there are also some examples of great practice in this area. And luckily, we're joined today by colleagues from two areas that are very impressive in terms of how they use their data, that will share their practices with you. So on that note, I would like to hand over to Lewis and Jess from Worcestershire.
Thank you very much, Agata. That was really interesting, especially the last bit about data black holes and the like. Hopefully we don't fall into that category, but we'll go and see. My name's Lewis Jones. I am a solicitor and the head of adults, childcare and education and debt recovery in Worcestershire. And myself and Jess Crows are going to be presenting this. She's a case progression officer specialising in public law proceedings. And we're going to be talking about utilising data to tackle delays in care proceedings. Let's move to the next slide. And some of you may have heard of the Radio 4 programme fronted by Greg Foote that investigates wonder products and whether they stack up to what they claim to be, called The Best Thing Since Sliced Bread or Marketing BS. And I thought the title fitting to this talk, as we've used the case tracker to move from 70 weeks in 2013-14 to around about 20 weeks at the moment. I'm going to cover 4 areas: the background to the development of the legal case tracker, its functionality, and then the development of a liquid logic legal workspace and workflows for legal planning meetings, and then how to develop a changing culture and embed good practice. We just go to the journey. Back in 2012, 2016, we were oscillating in terms of Ofsted inspections, getting rated inadequate and requires improvement, and were achieving between 50 to 70 weeks to complete our care proceedings. And then in 2014, this was causing considerable corporate concern, and in particular, the lack of information about pre-proceedings data and the ability to track drift and problems in cases. So we were given the green light to develop a legal case tracker with the digital innovation team. And at that time, legal developed it and children's services weren't heavily engaged. Then in 2016, we received an Ofsted rating of inadequate, and that led to the progression of a move to an alternative delivery model and the launch of Worcestershire Children First in 2019. If we just look back to 2016, that was quite a key date for us because at that time there was a new designated family judge, Judge Plunkett, the Director of Children's Services, Tina Russell, and the appointment of myself as the chair of the local Family Justice Board. But we all had a similar outlook about tackling delays in care proceedings. And that led to a resetting of roles and relationships between Children's Services and Worcestershire Children's First, and in particular, Worcestershire Children's First taking back responsibility for key decisions and care planning. It also led to full engagement in developing dashboards and the development of a whole range of information and the development of a clear practice hub for templates, policies, and protocols. Just move on to the next slide. This slide, don't read all this because what I'm going to do is deal with a range of 6 or 7 pictorial examples of what works effectively for the case tracker. But I should just highlight that one of the main issues that we had tackling early on was the reliability and accuracy of data. And this crucially required the appointment of a legal assistant case tracker called Lorraine, who was involved in the development of the case tracker and then crucially inputting data. Otherwise, that old adage of garbage in and garbage out would routinely apply. Just go to the next tracker. This is the first example of what sort of data we can see. It's one of the most useful tools, and it allows an easy access to live data that is RAG rated. In particular, we have a range of pie charts for both care proceedings and pre-proceedings, which show RAG ratings in terms of weeks. You can see on this one, if you click on, in those pie charts, if you click on the RAG rating, it takes you straight through to this list of cases. And you can see each of the cases is rated in a RAG form, and you can obtain detailed information from it. In particular, you can see in that center information, if you were to click on that, a whole range of information comes out about what's happening in the case and what delays have taken place. It allows you to quickly basically interrogate the case and understand where it's at. Next slide. Next one is a case planner. This lists the timeline for all milestones to achieve 26 weeks. And this case plan can be generated in advance of a legal planning meeting or a case management hearing to ensure that the 26-week timetable is communicated to all of those involved in the care planning process. And it covers things such as when the case is issued, case management hearing, family group conferences, viabilities, kinship assessments, social work assessments, the care planning meeting for final evidence, LAC reviews, ADM decisions, all the way through to IRHs and final hearings. And you can see just to the right of that, you've got both a target date, which means that you would be in compliance with the 26 weeks, and then we input an actual date in order to basically track where a case is up to at any one time. And that means that the RAG rating is continuously updated. Next slide, thanks. This slide shows milestones that are coming up within the next 8 weeks. And in particular, this report allows you to look at what evidence. It's usually final evidence that we concentrate that will appear. And it means that you can go and proactively track and offer support, particularly from case progression officers, to aid the completion of, especially around final evidence. You might have CPRs being required, as well as social work and sweat statements and care plans, all of which takes a lot of coordination. So it just helps you be able to focus precisely on when those pressure points are coming up. Next slide, please. This one shows basically a current workload by fee earner. So it's used routinely by the legal team. And it's in particular used the most because it allows us to allocate legal planning meetings, because we can see everybody's caseload. Urgent cases in particular can be allocated if they're coming in on a daily basis, and the data is live. Everyone else can see that caseload as well, so everybody knows who's carrying what cases, and that often means that people often put their hands up for allocation when they know they're light, or it means that they can be really protected when we're clear about what they've got. One of the key bits of the columns in there is, if you just look towards the right, is a straight to issue column. That basically shows cases where the decision has been taken to issue a care case straight after the legal planning meeting. So we'd expect to be in court within 2 weeks. And it means that you can focus on those particular cases and make sure that those high risk cases are moving steadily into court. And if support is needed, it means that case progression officers can be utilised to focus on those. Next slide. Now if we turn to the dashboards that WCF have built, these show, this first one here shows basically care and pre-proceeding caseloads in each of the social work teams. So that's basically, so you can see that at a glance, the details of the number of cases by case type and what each team is carrying. So if you click on those little blue links that you can see in there, it takes you straight through to that case and that case note and all the detail about the case. And it means that you can use that to discuss things like supervisions. You can have a look at what support might be needed if a particular team seem to be under pressure because they've got a very large number of cases. Next one. This one shows the plan and orders that were sought at a care planning meeting when we're formulating final evidence, and whether that plan was achieved at the IRH or the final hearing. You can click on the numbers in there and it'll take you straight through to the cases. I'm afraid it's not clear, but they're done by month, but you can also get annual data as well. The blue parts of the chart show those bits where we haven't been able to achieve the plans that we put into focus. But it does mean that you can then use that for reflective learning on cases and where we've not been successful, both from a legal and a social work team perspective. The next one shows another WCF dashboard, and this is cases by where cases have finished by outcome. So you can monitor trends. In particular, you can see that, for instance, there's a whole range of areas, revocation of placement orders, private law, EPOs, care, discharges. And for instance, if we wanted to monitor what's happening with supervision orders, as has been discussed quite routinely nationally in the public law working group outline, this, if you were having a whole spate of supervision orders, this would tend to indicate court proceedings had minimal effect on permanence. We can see from this one that care proceedings are the vast bulk of what cases finish with, and we'd assert that that means that it shows that permanence is being achieved for the children that we're working with. I can just go to discuss how various issues have come in relation to the development of Liquid Logic's legal workspace and the development of legal planning meeting workflows. It was one of the major omissions when we developed the case tracker back in the day that we didn't include legal planning meetings, which is the key entry point to taking legal advice and the progression of a case into court. So when 3 or 4 years ago, Children's Services and WCF moved to from Framework I to Liquid Logic, we took the opportunity to build this in. Crucially, those workflows have got a whole range of case types and an individual checklist for each type of case. So we would have a checklist that focuses on emergency and urgent proceedings, your standard care proceedings and pre-proceedings checklist, and a discharge of care proceedings one, as well as deprivation of liberty and secure ones. And we would have questions being asked that would allow information to be presented to the legal planning meeting so it's effective. Crucially, the social work team have to provide a whole range of key information and assessments, and this is gate-kept by group managers. After the LPM, that's post-LPM, legal advice is uploaded by the legal team to the LPM workflow. So you've got privileged legal advice, easily available and accessible. And you can see that that is accessible over a long period of time, often a problem as time goes on. The other key part about this is it produces clear data about volumes and types of case and timeliness. And as it happens, this has been utilised very usefully most recently, if we can just go to the next slide, because we had our Ofsted intervention and assessment 2 weeks ago. And one of the key things that they wanted to focus on was on pre-proceedings. So this data was produced for Ofsted at their request. And you can see, for instance, there's key data in the middle of there about the percentage of proceedings that were stepped into court or the percentage of proceedings that were stepped down from pre-proceedings. I know on an annual basis that we approximately go into court on 70% of our cases. And that indicates that we are front loading our cases and moving into court ahead of the game and allowed to effectively speed up and avoid delays in care proceedings. Just go to the next slide. Obviously, one of the key bits is how do we change the culture and embed key practice and embed good practice. And that's all about relationships. And a crucial part of that is the Local Family Justice Board, where in the main board, we focus on the key themes that we're going to focus on. We've got a whole range of key people there, as is often the case nationally. So you've got designated family judge, directors of children's services, as well as a range of a whole other senior managers. As a part of this interaction, we particularly have a very robust designated family judge who often seeks explanations for delay, and that can be on individual cases, or where themes develop, we would undertake audits. So for instance, we had a spate of IRH adjournments which we were able to interrogate, data applications for kinship assessment, and also more recently adoption medicals not being completed, meaning that placement orders couldn't be issued, which was adding 5, 6, 7, 8 weeks onto the timetable. So all of that is then communicated and disseminated. Go on to the next slide. And other part of obviously key development of embedding both the culture and change is our relationship between both the legal department and WCF. And in particular, we do this by having regular liaison meetings on a 6-weekly basis to resolve issues, provide updates, and reflect on themes and guidance. In terms of how cases are progressed, we have key meetings. So one of the key ones that we have is the midway kinship team meeting, which allows a crucial look to bring everyone together and assess if a case is on track, and discuss the issues arising, consider whether the contingency plans need to be activated or not. And in order to make sure all this is consistent, we have a case management system that has a lot of precedents, which allows, in particular, say after a case management hearing, an email to go out from legal department to absolutely everyone involved in the case, including adoption, kinship, the social work team, case progression officers and IROs. So everybody's clear about the tasks and the timetable.
So this slide
I'll hand over to Jess.
So I'm Jessica Grove, I'm one of the 3 case progression officers. This slide is about the link to the planning and permanency team. And as you'll see from a previous slide, it is supportive of us achieving milestones and timeliness on cases. So in legal planning meetings and in care planning meetings, it allows the early identification of parallel plans for children to allow us to progress and prevent delays. So the early identification of where an adoption medical might be needed, where support might be needed to achieve a roadmap for ADM, and support to identify and create the links with ACE. So the planning and permanency team have a really fantastic working relationship with ACE, and allow the early consideration for foster to adopt placements and prevent overall delays. We can go to the next slide. And then this one is around our role and the support that we're able to offer. So there's, like I said, there's 3 case progression officers. We support alongside Lorraine with the case tracking and the case monitoring. It allows us to offer that tailored support and that intensive support to teams or to individual workers and team managers to assist with quality assurance, to support with reflective discussions, and make sure that any evidence and assessments that we're putting before the court is of the best quality that we can achieve. It also allows us to identify themes and areas of need and best practice. That allows us to tailor additional training or tailor tools and research and templates that we're putting on our practice standards, so all social workers will have access to that. The process also allows us to identify stuck cases to allow us to pull together key individuals, whether that's group managers, team managers, assistant directors, as well as social workers, and links to maybe the kinship team, to look at how we can progress a case to prevent delays and to achieve the best outcome for that young person.
Thanks very much, Jess. You can see this national heat map, and it's great to see that our care centre is doing so well nationally as the only green glowing area that is consistently getting under 26. But so what? Achieving these weeks is not an end in itself. Go to the next slide. The aim is obviously to achieve positive outcomes for children by achieving timely permanence, as all the evidence shows that delay in achieving permanence is detrimental to children's welfare and long-term outcomes. I'll let you decide if you think this is the best thing since sliced bread or marketing BS, but here are some of the recent feedbacks from Ofsted inspections this year, with the big one awaited from 2 weeks ago. Thanks very much for listening.
Thank you very much, Lewis, Jessica. Really interesting presentation, and it's really encouraging to see how robust tracking of data was one of the key factors helping you to improve the timeliness of proceedings, and what is the most important thing, ultimately improve outcomes for children and young people. I will now hand over to colleagues from Warsaw Council, who also have extremely effective systems in place around effective case tracking. Rita, over to you.
Okay, good afternoon, everybody. I'm Rita Homer. I'm the head of the Family Safeguarding Service in Walsall. I'm joined today by Mark Grigg, who is the analyst who provides the data analysis for the regional Black Country and Telford court data set, and Sandeep Kaur, who is our court progression officer. So could you just move on? Our presentation isn't as fancy as Worcestershire's. Very, very good graphics. Okay, so in relation to what we're going to be talking about today, Mark is going to be giving a demonstration of the regional dashboards, looking at the process in place for ongoing data collation and potential challenges, how we use data to monitor in terms of management oversight, and how it feeds into best practice and securing permanency and effective outcomes for children and families within the court system. And also what we're going to be looking at is Sandeep's going to be concluding with a case study that looks at a family's journey through the court system using the tracking mechanisms that we have in place. Just moving on to the next slide. So in relation to how data is tracked locally that supports regional court learning, one of the most fundamental elements is actually that so what factor. What are we using the data for? Is it to give us business insight? Is it to give us insight? It's to improve practice. So the regional data set that each local authority feeds into. So we're going to look at a wide lens of the regional data set and how this then translates into our more granular detail in Walsall. So regionally, what we look at is analysing and identifying the causes of delay within each local agency and the system as a whole, and we put in place local actions to improve the performance and delivery of the family justice system. So in the PLO subgroup, I'm the chair of the PLO subgroup. Mark is helpfully the technical expert in relation to the data set. But what the PLO subgroup does is it evaluates and reviews the data in order that the data provides the threads that then go on to support the more qualitative analysis that each local authority engages in alongside colleagues in CAFCAS, the judiciary, and legal colleagues. So, for example, more recently, we examined reasons and issues that led to court delay. And what we established is that what we'd seen across certain local authorities was an increase in injuries in non-mobile babies, non-accidental injuries that required the use of experts, and also the timetabling of fact-finding time. And so that was really pertinent to us because it then led on to further work around actually what is the practice that we're conducting in relation to how we look at risk resolution assessments when we have really high risk situations. It also provides an opportunity to learn from each other as local authorities in the Black Country, Telford and Shropshire region, where there is best practice, where we have got local authorities who are concluding consistently within 26 weeks, where there's effective use of pre-proceedings. This then feeds into the wider local family justice board, which, similar to Worcestershire, is chaired by our director in Walsall, and also the director of CAFCAS, made up of senior managers, the judiciary, and obviously the local DFG. What we have is a wider action plan where that focuses on the pertinent issues that have arisen from what the data and the qualitative analysis has told us. For example, the use of independent experts. We've broken down the use of independent experts, which Mark can talk about. So looking at where there's been significant delay, was it necessary for that expert to be commissioned? Could a social worker or a guardian have undertaken that issue? Did it make any impact in terms of securing that decision making within the court? And also what the themes that we draw out from the data, it supports our local Family Justice Board Development Day. More recently, we've had a local Family Justice Board Development Day that was focusing on a wider piece of West Midlands work in regards to developing a best practice blueprint for pre-proceedings. We were supported in this activity for Annie Bertram, who's safeguarding survivor, but we also drew out themes. So, for example, the upsurge in applications for doles, and then our intention is to take that further into the next LFJB Development Day and look at what the national picture is telling us in relation to the work that's currently been undertaken in the High Courts in London in relation to doles. It also gives us an opportunity to engage with other LFJBs, and this is all about sharing best practice and resources, identifying differences in performances locally, regionally and nationally to improve the consistency of best practice to enable timely decision making for children and families in the court system. But critically, it enables insight. So we aren't using that, we're not using digital footprints or, data for compliance purposes. This is it or control. This is around developing insight that then drives forward best practice. For example, we have the first Black country FDAC, and we're currently comparing ordinary proceedings with FDAC proceedings, not only on a quantitative perspective, but also the experience, that softer information. So the experiences of families who've gone through, sometimes we have families who've gone through both sets of proceedings, and we're taking interviews and looking at how we can translate some of the learning from the FDAC into ordinary proceedings. I'm now going to hand over to Mark, who's going to talk through our dashboards before moving over to the case study.
Hello, good afternoon, everyone. This is just a quick overview of the process that I go through to collate regionally for the PLO subgroup in the Black Country, Telford and Shropshire. So this is the starting point. This is a screen grab from an online collection sheet that I've created where each local authority can log in and log every case individually. So the main reason behind this is to keep all the data that we hold regionally uniform, because everyone in their local authorities might have slight differences in the way they do things, but when it comes to looking at that regionally, we need it to be as uniform as we can to allow for the best analysis. So that picture on the left there, just an example of the start of that. So you'd put in the local authority, the email address, and it goes on to ask several things about the case ID, court case number, and about the delays. Anything like that is included. I then collate that into a master sheet where all of the data that we collect through the sheet is kept, and also all the historic cases as well. And from that, I can then work out things like timescales and different things that we'd like to analyse in the region. If you look to move on. So this is just two screen grabs of the sort of things that we collect on the master sheet. So really easily from the top left there, it would be the local authority, and we go along there with the date of the application and so on and so forth. For each line will be a case. We can work out the timescale. We can work out if there's any expert assessments produced. But again, it's just about keeping it so uniform so that we can analyse it better into Power BI for the dashboard, which is the next slide, please. And this is just examples of 4 pages from the dashboard that we use. So even in the last year when this has been used in our region, this has improved dramatically in terms of getting everything uniform. So the top left one there is just looking at the cases and the application types for each. When we first started, there were probably 6 or 7 different types of application type, when realistically it was just the two and the other that we've seen there. And then it's just a really bold outlook of the percentage of cases that are completed within timescale, red or green. If we move to the right hand side just there, that one looks at pre-proceedings. So it looks at the amount of cases for each local authority in pre-proceedings. And then we can also compare with the columns with the rag colours on the right hand side of that one, how pre-proceedings affects our timeliness. So for example, in the last couple of meetings, we've noticed a couple of the local authorities have took a lot longer, even though there's been pre-proceedings, which was something that we were looking at recently. The bottom left one is a percentage column, again, just rag rated with the concluded timescales for each local authority. So green is below the 26-week target, and moving on through different amounts there, red being over 52 weeks. And again, we can split that up by quarter, we can split it up by local authority, and we get like a real visual look at how people are performing in the region. And then to follow on from what Rita was talking about with expert assessments, the bottom right square there is a look at all of the cases, and then it splits it between the top ones with no expert assessment and the bottom ones with expert assessment. And probably with no surprise, you can see there's a lot more green on the ones without expert assessments, but then we can start to look at the outcomes. So although we obviously have a lot longer in time scale with an expert assessment, often the case outcome is the same. So we can have a real talk in the group about those type of things. So just quickly, I've mentioned there that colour coding is used just to make it sort of easy to visualise whilst we're in the meetings. But I think that's the main point there is we generate talking points in the group. So it's not just me talking for half an hour, it's a conversation, and we use the different visuals to get a grip on what we're going to talk about in the group. And then I've finally said there that we can send this out to local authorities to go over their own data or the region's data, and that's something we can also do. I believe it's Sandy next.
I think it's me now. Just
Oh,
really,
sorry,
yeah.
sorry.
No, that's fine. So we didn't do a rerun of yet another dashboard. So it's really just sort of giving you an overview in what we do in Walsall. So on a local authority basis. So we track and we have systems in place and digital solutions in place where we look right from unborn infants. So we track unborn infants on a monthly basis with midwifery for families who are open to children's services. There is a particular lens where we have recurrent pregnancies or families who are in existing care proceedings when parents are pregnant again. And the intention is to ensure that we provide the support in a timely way, that the support is in place for parents to make sure that they've got the fairest and best opportunity at retaining their child, and that we don't fall into this this cycle of constant removals. When we did undertake activity in looking at some of the best practice examples where we had concluded positively within 26 weeks, what we noticed in both Walsall and I believe Wolverhampton, Mark, was that actually the families where we were concluding within 26 weeks were generally where we'd had pre-proceedings, where we had really robust pre-birth pathways in place. We have got a tracker very similar to Worcestershire's, and the data that collated is fairly similar, and I'm sure it is across a lot of local authorities in relation to what we're tracking. This data collation is then translated into a quarterly report of our performance, and then that leads on to training, development, exploration of independent experts. We work very closely with colleagues in CAFCAS and within our legal team to look at how we can better commission independent expert assessments. We need, we look at actually were they needed, etc. And really sort of examining and exploring the causes of delay. We have developed meetings with CAFCAS we meet as a senior management team on a monthly basis. We meet across the IROs, the independent reviewing officers, children's social care, with CAFCAS to look at particular themes. So we're really trying to use the data in a creative way that drives forward best practice, and looks really out. We can secure permanency for families, be that reunification, be that foster for adopt, or be that placement with connected care. Just moving on. Okay, I won't go through this because I think it's, these are some of the examples of what we track. This is what we've used. I've talked in the presentation previously around what the data is used for. We also have permanency systems where not only are we looking at the child's journey within care proceedings, but the child's journey within the care system. And what we're looking at is making sure that we achieve permanency options for children where care proceedings are concluded. It's also enabled us to shine a bit of a lens on reunifications, and we are currently developing and extending our family safeguarding model to look at reunification. So there's quite a lot of training and development that's taken place within our children and care teams and with our IROs and foster carers to look at how we can best support those children where long-term fostering is an option, and where there are still family members obviously within that system. Where we do have a permanency coordinator who has control of the permanence tracker, and what the permanence coordinator will do is she will draw out themes from the tracker, and these will then feed into the permanent steering group again, that looks at how we can improve practice, training and development on an individual basis. If there's a need for a reflective discussion or a care planning meeting with CAFCAS colleagues to look at how we can potentially move forward, then that is another element of what we do. Okay, I'm going to hand over to Sandeep now, and Sandeep's going to talk through a case study and as an example of how we've used the systems.
Hi, so this case study was based on a mum that was pregnant with twins. So we came to know her mother back in February 22, pregnant with twins. The other removed and an echo with maternal grandmother. And then it came to Legal Gateway panel on the 31st. Agreement was given for pre-proceedings and a notification was sent to a regional adoption agency, and it's tracked via a PLO tracker. And then on the 14th, it was agreed for fostering for adoption to commence, to find a link with the RAA. And between Legal Gateway panel and the 14th, 2 months later, we had a potential link for the girls. Although there's 3 potential fathers involved, there had already been assessed, I think, in the previous set of proceedings. So then we issued an ICO on the 1st of July. So that was 2 weeks. So 2 weeks later, paternity was confirmed, care adoption was confirmed after the ICO, which was about 1 month and 2 weeks after the ICO was granted. And then it was tracked through our court tracker and permanence panel. And then on the 22nd of July, a potential link had been identified for the twins, who were in pre-approval stage. So then on the 9th of August, once paternity was confirmed, father didn't engage with any of the assessments, and mother's assessments did not recommend twins to be in at care. So then on the 18th of August, we had the care plan was confirmed and it was timetable straight through to IRH. And then the SHOD code decision was made on the 4th of October. So that is Yeah, and then there was a delay as the approved for fostering for adoption not progressed, but it was but the informal pre-meets carried on, and it was within the timescales. And then the care and placement orders were granted on the 16th of November, and the care proceedings ended in week 19. Approval was given for the twins for fostering for adoption on the 21st of November, and a matching ADM decision was made on the 24th of January. An application for adoption was made, and the adoption was granted on the 31st of May 23. So from the day the ICAR was granted up to the adoption orders made, we're looking at about 10 months and 4 weeks for the whole process that ended. Yeah, and that was a case study.
So it's just an example of showing you how tracking's used throughout the court system. So I don't know if anyone's got any questions.
Thank you very much, Rita, Sandeep, and Mark, for this presentation. I think it's really interesting to see how the tracking supports your practice based on a case studies, and also some creative examples of data use that you are trying to embed. I'm afraid we don't have that much time for questions. There was a quick question for Lewis submitted by one of the attendees, if it's possible to share examples or themes from reflection about the sought versus obtained outcomes. Don't want to put you on the
I think the one that sort of comes to me sort of instantly is we had a whole spate of placement orders and the plans for adoption not being successful over a period of a year. And when we started investigating that, it appeared really that there were quite a lot of problems with our sibling assessments. So we basically commissioned a much better range of sibling assessments to ensure that problem didn't continue, and that did lead to a successful change in practice, which was very good. It can be quite a hard thing. It's quite useful. I know some of my lawyers get very defensive when I say, you know, why didn't you achieve this? And it might be a very finely balanced case, so it can be quite hard to, you know, we grade it as unsuccessful. It's not to do with that. It's just to do with looking at what evidence could have changed that decision. Could there been anything that led to a different outcome? Focusing on things like the BS analysis and the like. I hope that helps.
Thank you. And a very quick question for Rita, and then we're drawn to a close, because I'm conscious that people may have other meetings to join. How is tracking being used to identify long-term fostering placements for children to move into when they become looked after?
We have the permanent.
I'm afraid we might have lost Rita in so what I unfortunately we will probably not be able to hear her response, but what I propose is that I'll go back to Rita, and we may share her response to this question when we are sharing the recording and supporting slides. On that note, I will draw this meeting to a close. A big thank you to all the speakers, fantastic presentations, and I think some interesting food for thought for all of us. It was a big pleasure to have you here, and hope everyone found this session useful. Again, thank you very much for joining us.